the single most expensive Medicare mistake is also the most common one, missing your initial enrollment period. You get exactly 7 months. 3 before your 65th birthday month, your birthday month itself, and 3 months after. Miss that window and the IRS tax on a permanent 10% penalty for every 12 months you were late. Wait just 1 year and your Part B premium goes up 10% for life. Wait 10 years and you're paying double. Over 20 years of Medicare that can cost you nearly $49,000 in extra premiums you never had to pay. There are no appeals, no exceptions, and no way to undo it. Mistake number 2, skipping Part D drug coverage because you don't take any prescriptions right now. The IRS does not care. If you go without creditable drug coverage for more than 63 consecutive days after your IEP ends, you owe a permanent penalty of 1% of the national base premium, which is $38.99 in 2026 for every month you are uncovered. Wait 2 years, and that's an extra $940 added to your drug premium every single month, permanently. Over 20 years of Part D, that's more than $2,200 in avoidable overpayments. The cheapest Part D plan available in most states costs under $10 a month. Buy it now, even if you never use it. Mistake number 3, using COBRA after retirement and assuming it counts as Medicare creditable coverage. It does not. COBRA is continuation coverage from your former employer. It protects you from a gap, but it does not stop the Medicare late enrollment penalty clock. The moment your initial enrollment period ends, every month you spend on COBRA instead of Medicare Part B adds another 10% penalty per year, forever. Here's the rule almost nobody knows. When you retire from a job with employer coverage, you get an 8-month special enrollment period to sign up for Part B penalty-free. That 8-month window starts when your employment or employer coverage ends, whichever comes first. COBRA ending does not restart it. If you wait for COBRA to run out before enrolling, you may have already blown your penalty-free window. Mistake number 4, waiting on Medigap, also called Medicare Supplement, until after you see what your health costs look like. You get 1 guaranteed open enrollment window for Medigap, 6 months starting the month you're both 65 and enrolled in Part B. During that window, no insurer can deny you, charge you more for pre-existing conditions, or limit your coverage. Once that window closes, federal law gives you no right to buy Medigap at standard rates. Insurers in most states can reject you outright, charge dramatically higher premiums, or exclude conditions entirely. This window closes once and never reopens. It does not matter how healthy you are when you miss it. What matters is that you no longer have the legal right to buy in. Mistake number 5, canceling your current health plan before your new coverage is confirmed in writing. This sounds obvious, but it happens constantly, especially around employer transitions and Medicare start dates. If there is any gap between when your old plan ends and when your new plan begins, 100% of every medical bill during that gap is your personal responsibility. No retroactive coverage, no appeals, no grace period. The rule is simple. Get written confirmation that your new plan is active before you drop anything. An email from your insurer, a member card in your inbox, a confirmation number, something in writing. Then, and only then, do you cancel. Mistake number 6, contributing to an HSA after Medicare enrollment begins. The moment you enroll in any part of Medicare, Part A, Part B, or both, your legal HSA contribution limit drops to 0. Any dollar you deposit after that date is an excess contribution. The IRS hits excess contributions with a 6% excise tax every year the money stays in the account, plus you lose the income tax deduction you would have gotten on $4,300, roughly the 2026 individual limit. That's $258 in excise penalties plus $946 in lost tax deductions, over $1,200 gone. There's also a backdating trap almost no one knows about in Medicare Part A. Enrollment can be backdated up to 6 months. That means contributions you made before you signed up can become excess retroactively. Stop HSA contributions at least 6 months before your Medicare start date to be safe. Mistake number 7 is the sneakiest one, not planning for IRMAA, the income-related monthly adjustment amount. IRMAA is a surcharge the Social Security Administration adds to your Part B premium if your income is above certain thresholds. Here's the part that catches people off guard. SSA uses your tax return from 2 years ago. In 2026, they are looking at your 2024 modified adjusted gross income to decide what you pay right now. At the base level, income at or below $109,000 for individuals, you pay the standard $22.90 per month. But push into the top bracket, income above $500,000, and your premium jumps to $689.90 per month. That's an extra $487 every single month compared to someone at the base rate. A one-time income spike, a Roth conversion, a home sale, an inheritance can push you into a higher bracket for an entire year. Watch your income in the 2 years before and during Medicare enrollment. 7 mistakes, and every single one is preventable if you know the rules in advance. Enroll in Part B during your initial enrollment period. Buy Part D coverage even if you don't need prescriptions yet. Remember that COBRA is not creditable. Enroll in Medicare on time. Use your 6-month Medigap window before it closes forever. Always get written confirmation before dropping any existing coverage. Stop HSA contributions the moment Medicare enrollment begins. And keep an eye on your income. IRMAA looks back 2 years and the surcharges are steep. Do all 7 of these right and you could save close to $50,000 over a lifetime of Medicare. Subscribe for a new Medicare breakdown every week. No jargon, just facts that keep money in your pocket.